there's like a spot for the date, and you put them over like wine bottles or liquor bottles, so that you know if it's been tampered with or opened while you weren't there, or if it was opened by somebody other than you. So those are the two big that we've been working on. Go ahead. And then I'm also excited about the stuff that's coming up. So we're a federally funded coalition. We have the Drug-Free Community Support Grant, which is a 5-year grant that provides us with $125,000 each year to do work specifically for underage drinking and marijuana use in the community, which is going to be even more of an issue as our state is looking at commercializing marijuana, and also concerning because that particular bill is not ever going to pass through public health. So there's a lot of red flags there. We definitely want to get a jump on that. And to do that, we're planning to do some capacity building around youth in West Haven, and actually starting a youth council. So a mini version of the West Haven Prevention Council that is entirely facilitated and run by young people living in West Haven. And then my ultimate goal is next summer, there is a conference in Rhode Island called the Youth to Youth Eastern States Conference. And it is an entirely youth-led and adult-guided conference that focuses on substance use prevention and leadership development for young people. It's 4 days and 3 nights, and every young person I've ever gone to, or I've ever brought to that conference or gone to that conference with, cannot stop talking about how life-changing it is. Because normally when you think of a conference, you think of something that's more lecture-based, it's run by adults, it's an adult teaching kids, but this is entirely flipped. It's kids teaching their peers. And as kids go through the program, they eventually can apply to be one of those youth staff members who runs the conference. So I'm really excited about it. I think it'll be a really good opportunity for some young people in West Haven to get some leadership skills and kind of to meet people from all over the world. You know, it's the Eastern States Conference, but we see people like international students as well at that conference. So that's one of my biggest goals coming up. If we can get the young people on board that marijuana isn't good for them and isn't safe for them, then that's half the battle. And I think that's ultimately the best way to do it, is to have young people talk to other young people about it, because that's who they're most likely to listen to, unfortunately.
Yeah, peer advocacy is always best.
Yeah. So I'm happy to answer any questions about, what we might be up to or what we do or what we have done. I love talking about it. I could talk forever. So I'm gonna be quiet and let you guys ask questions if you have them.
Nicole, this is Maureen. First of all, welcome, and we're excited to have you with us. I spoke with Diane from Youth and Family Services just today, and I think we're going to be working with you on a Narcan training.
Yeah.
Okay.
So that is something I hope to get running over the summer, to partner with a couple different organizations, Youth Services being one of them, to do Narcan trainings. So that's the opioid overdose reversal drug, but also QPR trainings, which is an evidence-based suicide prevention strategy. So if you guys are on board for that, I'm super excited, because I think that community education is key on those two topics.
Yeah, and definitely, as I mentioned to Diane, we're happy to co-host it, and so anything you need, just reach out, or I could send you an email with all my contact info.
Yeah, that would be awesome. Thank you. I guess I do have an ask for the group as a whole, which is, would I be able to send you guys a survey, kind of like we've been doing for the needs assessment, to see what your perspectives are on the substance use issues that are growing in West Haven, or what's on the top of your concern list, or maybe like what educational opportunities you'd be interested in having in West Haven?
Sure. Maureen and I were involved with BOA for, some of the localized awareness from drug. Maureen, if you recall, I think 1.5 years ago or so. So yeah. From the health department, Maureen, and also being a medical advisor, I would love to participate in whatever way we can.
Awesome. Thank you, guys.
No, I mean, surveys, we do lots of those. We're happy to answer something that's, constructive and we know could be helpful.
I'm willing to help wherever. I mean, I'm already on the committee, so.
And I think, so is this something, I apologize for coming in late, but is this something that's been done with parents?
So I believe that West Haven did do a parent survey last year. I haven't seen it, but I believe that it was either a parent or community survey that went out.
In the very beginning, I believe.
In the very beginning, yeah. And again, we can include that in the data that we come back and present to you guys at a later time.
No, I think that would be helpful to have a perspective. I think, as parents, they may or may not have an idea of what their concerns are or what's out there. I mean, we know from a different, and we don't always know, right? We know a little bit, we see data, but I think, honestly, it's very impactful to have families or the community answer. It's just my opinion.
Yes, it is. And it's always good to have that data and the student data to be able to contrast, like, what do the parents think the kids are doing and thinking, and what are the kids actually doing, and what are the kids thinking that their parents are thinking versus what do the parents actually think. So now that we have both of the pieces, absolutely.
I just have a question. Is vaping or anything of that nature going to be somehow involved? Because I know that that's become a big thing around that didn't necessarily exist in the past.
Yeah, so vaping is definitely on our radar. We have a local state level grant called the Local Prevention Council grant that at this point is specifically to address issues of vaping. But our focus has shifted from vaping nicotine products to vaping marijuana, THC, cannabis products, especially as, marijuana starts to seem less harmful to young people. And as those products become more readily available to them. So I know some feedback I got from my interviews that I've done with people about West Haven is that, the surrounding towns of Milford and Orange and Woodbridge tend to be vaping more than anything else. But in West Haven, it really seems like it's marijuana use, whether that use is smoking or edibles or vaping, or using any variety of concentrate. And they suspect that's because of income and finances, and that marijuana is just easier to afford than vaping, and like the nicotine that you can buy in the store versus what you can buy outside of the store. I haven't gotten to look at our data. That's just what I've gotten kind of anecdotally from some people that live in West Haven.
Okay.
Does anyone else have any questions for Nicole? Yeah, I'm so glad you came though, because I definitely think it's a natural, I think we all need to be aware of what you guys, it's invaluable. There's so much that you guys are doing with the billboards and the education in the community, the surveys with the kids and working to engage the kids. It's just, and it's only been a year and you guys, I guess I can say there's just already been so much done. So
I'm really excited for the future of West Haven Prevention Council, particularly as we start to kind of explore life beyond COVID. Like, we know that COVID's here, and we know we're never really going back to the quote unquote normal. But it'll be really exciting to get to work with young people again and be able to do some more community events and direct outreach to people. Because we know the thing that's been missing most in COVID from a social emotional standpoint is just human connection.
Mhm.
And that is related so much to everything that, from mental health to substance use disorders to physical health. It just ties everything together. So the more we can work together to bring that back to people, I think it will, when it's time, it'll be amazing.
Well, I appreciate you coming and taking your time with us. And thank you.
Thank you. If you guys have any questions, Heather has my email address. Feel free to hit it up. I'll put it in the chat too.
Awesome. Thank you. Yeah, do that, please.
Thank you, Nicole. And please, feel free to send a survey over
Yeah, of
to
course.
Dr. Mohammed and me.
All right.
Thanks, Nicole. And
Thank
definitely,
you.
if you feel like you need to come to us for things, please know that the door is open both ways. So if you want to come and talk over something with us, you're more than welcome to get on our agenda anytime you'd like.
Thank you. I appreciate that.
I second what Kevy said.
All right. It was good to meet all of you guys.
Thanks, Nicole. I'm sure I'll talk to you tomorrow, right?
Yeah. Enjoy your night.
Bye.
Bye-bye.
So just to go back to the agenda, Catherine had to sign off. So if we can table the vaccine hesitancy video to discuss with Kathy at the next one, but I will share the video, I think, with everyone by email, because I think it's a great, some public education ideas. And as she talked about that outreach that at Brett Wyatt Park, I think she was saying, just anything we can do now. I think we're at the point with COVID, it seems we really just need to be getting out into the community and reaching people in many different ways. So, but if we can just table that until next meeting. If we could circle back to the review of the minutes, if that's okay.
Excuse me, Heather, I have to run.
Thank you, Joe, very much.
All right, I'll talk to you soon. Take care.
Thank you. Thank you, Joe, for presenting. I appreciate it.
No problem.
So if everyone got a copy of the minutes, I sent the March and the April, if you had a chance to review, and if anyone had any questions. And if not, if we had a motion to approve them.
Motion.
March and April, okay?
Second.
Yep.
Perfect.
Yep.
All inclusive.
Thank you. Okay, so those were approved. So just next thing on the agenda then was Maureen. Just if we can just talk about, and I know Joe actually kind of gave us, before you got on, a quick update of where our data was currently in West Haven. He said we're at about 50%.
Not sure we're that high.
Maybe he was talking about first dose.
Yeah, well, so I know that starting with our population 65 and over, we have a 91% vaccination rate, which is excellent.
That's awesome.
Yeah, isn't it? And let me get my data, because the lowest age group was 18 to 44, but I think that's going to, well, now that younger people are being vaccinated, I hope hopefully that improves a little. That was I think the data I found yesterday was like 41% overall for West Haven.
Okay.
I mean, that's almost 50, but
yeah,
still a bit to go.
Yeah.
And 36% was the 18 to 44.
And is that the trend statewide?
It does seem to be a trend statewide.
Yeah, that's what I thought. Okay.
Yeah.
Are they pulling these percentages of vaccine eligible people or total population?
Eligible.
Okay.
I believe.
Maureen, I think it's total. That's why percentage looks a little lower. But if you were to, because I don't think they have a good census-based data to dissect the different age group. I mean, I know for sure in Orange, so I'm pretty sure that that's West Haven too. These are all, denominator including everybody, right? So if you were to look at this number, you may want to add 5 to 10% because that's not the true reflection of the population in any city or town. So based on the recent poll as of May 6th, vaccine percentage with at least one vaccine is 46% for West Haven and 33% fully vaccinated. So every 1/3 person is fully vaccinated in West Haven. So that's a good trend.
That's great.
And I can tell you again, you add another 8-9% for infectivity rate, those who have been infected and now are positive. And then you also need to inflate this number because it's not age specific. So what Maureen is telling you, we know that it's 80 to 90% among older population. And that's the age specific, but still better than many states out there.
Yeah, we're not that far off the state average. I just looked real quick at the CDC numbers. I'm not even sure it's as of, it is as of today. Connecticut is 57% first with at least one vaccination and 45.5% fully vaccinated. So that's not that bad. I mean, we're definitely, Connecticut's above average, and I think we're pretty decent as far as our.
Actually, it's actually higher based on this data poll from CDC. It's 57.6% overall with at least one dose and 45% with fully vaccinated in the state.
I want to just go back to Joe's point when he was just quickly talking about the data. I do a lot of the same what he was saying. I'm always looking at New Haven, Waterbury, some of the big cities. I mean, I know we're a small, big city, but I feel like in comparison, we're doing well. I mean, I'm definitely encouraged by what I see. And, I mean, obviously,
I honestly think those clinics offered by the health department have across the board really helped pushing the number. If you had zero involvement from public health department all across the state, I doubt that we would have reached that very quickly. That's all the hard work that goes behind the scene from each individual health department. They've really worked tirelessly based on their population size to reach out. You know what I mean? So what West Haven is doing is remarkable. At the same time, to get many people vaccinated.
The clinic we had today proved my theory that we need to be doing more community, ours, not just mine, community clinics like that, because everyone who came, maybe with the exception of a family and another party, walked.
Yep.
So there were a couple of things that were immediately taken out of the equation is transportation. We vaccinated 17 people there. And then Heather, you had some homebound. So that's actually quite a lot for when you think about some of the walk-in numbers we have at Noble Street were much far fewer. I mean, we had second doses, but so I think that says a lot. Today's clinic was a good indicator of where we need to be focusing.
And I think it was before you signed on that Kathy was mentioning the event at Brett Wyatt Park, which those are the places I think just, in the parks where we can, if, just to be there the week today. Today was definitely, it felt really good to see those people walking up and saying, oh, I just had to walk across the street, You're 100% right.
No, I agree. It did feel good too. So I mean, that's something that we need to take a look at. in the coming weeks. Amir, Dr. Muhammad, have you heard anything further about the progress on boosters, if any?
No, not yet. I wouldn't be surprised if that's the case. However, I think the biggest challenge at this time is the 12 to 15 age group, right?
Mm-hmm.
So the schools are going to be off in a month or so, would be difficult. So how quickly they can get to these vaccines at their pediatrician office. So I think we will be busy, or at least we would have to wait throughout the summer how this segment of population gets vaccinated, and therefore, if any booster, we're talking about late October, November, December timeframe. That's sort of my guesstimate based on.
Are you, Dr. Muhammad, are you hearing from anybody other than the Pfizer CEO that boosters that's the only one I can find that's actually pushing that potentially there's a booster, which, I kind of take with a grain of salt.
Yeah, I mean, it's not actually a booster. I think it will be more focused on the circulating variant. Just like flu, we've calibrated according to the circulating strain. So I think that would be interesting. Yeah, I mean, you can call it a booster as a third shot, but technically, I don't think it would be the same as the one that they have used in the 2 doses. So my guess is they have to tweak. They have to tweak it based on the circulating strains, and that would technically not be a booster. That would be like one another for the yearly, right? For the 2021 to 2022 circulating strains. Now that we know what's happening in Asian countries, I mean, every poor state is lighting up badly. Not just India. You talk about Nepal. You talk about, and the funny, sort of an interesting thing was Seychelles. That island that was given the vaccine, their population was vaccinated, and yet they have outbreak there. So what I think it was Sinopharm or one of the Chinese vaccines. So they need to look at what sort of target strains it kind of looked at, and now what's the circulating strains. A lot of things is happening in different parts of the world. It's very, chaotic at the moment, unfortunately. And as we have seen, these strains don't stay there, right? People are going to come in, and just like what would happen, maybe not that badly, that what happened from Europe early part of the last year when we had the European strain circulating. I don't think now, with specific measures and a little bit more tightening of those public health surveillance, I believe that we will need to see what are the strains that are circulating.
We did get some good news at work the other day about breakthrough infection, that the rate was lower than expected, that I think it was only a 0.01% of vaccinated adults having a positive COVID infection after vaccination. So that was encouraging news.
That is good.
That's much lower than I expected to ever hear.
Yeah.
So, Maureen, was there anything else that you felt we needed to? We talked about the data. We talked about Joe updated on the mobile clinics as well. Was there anything else that you had wanted to update us about and talk about? Questions?
No, I mean, I think that when's the 19th? That's when the floodgates open, and I guess I just really want to caution everybody that despite the things that are opening, we're still not completely out of the woods. That's what I keep telling everyone, and I just, I'm proceeding with caution. I don't know, Dr. Muhammad, have you, what is your town, what is Orange doing? Are you starting to open up at all?
Yeah, you mean the town hall and others? They never were closed completely. There was always, business going on at a very slower pace. I mean, it's not as busy as obviously a city like West Haven, So we have those preventive measures in place, plexiglass, masking, and all those, Purell at the entrance, what have you. Pretty much that's it. We don't expect anything different going on. I mean, the major issue that we have to kind of tackle is all these parades, the fighter, festival and Memorial Day parade. So we're hoping that DPH takes into an account. They keep saying that after May 19th, we will get those recommendations how to manage the crowd and be able to. So there are a lot of situations going on. I mean, the schools are asking about the graduation, so we just have to give them the best source of advice available at this time. I think, and yeah, that's about it, Maureen.
Well, we received some guide. Did you get the guidance on graduations and proms?
Yeah, but
it doesn't. I guess what right. The only thing about it is it talks about. It must have been written before the mask.
Yeah.
Masking, because they're not recommending food or any events, right? So, but that's because they don't want you to take your mask off. But now with no masks outdoors, that sort of confuses things.
Yep.
So did they specify like after May 19th, no masks outdoors, even in a mass like a graduation? Is that what they're implying?
Well, I think they're saying while we're updating all these guidelines, refer to CDC. That's what the general which is fine. I mean, CDC still recommends when you go out in public, you wear the mask, you keep the social distance. They're not taking the mask completely. It's going to be states' individual response on how to do that. I mean, there's a lot of pressure from different sources, I guess. That's why everybody's sort of jumping into it. But unfortunately, at this time, we haven't seen anything definitive coming from DPH. So let's stay tuned.
Yeah. That's it.
I am on mute and I was starting to talk. That was bad. Sorry. Can you hear me now? So if there's nothing else, any other questions, any concerns, anything anyone wants to discuss before we ask for a motion to adjourn?
Just one more thing about the mask mandate and the restrictions on outside. I think there's like a whole grid the CDC has, like what's safe, what's not safe. And like, outside with your family or whatever is safe, but large gatherings of people outside still should be masking. So there's like a whole, from, your own backyard to, the Jimmy Buffett concert, Jimmy Buffett fan, no masks to mask. And I just think it's really important that we keep reminding people about masking. Like nothing's going to hurt you by wearing a mask. You know what I mean? It doesn't cost you to be overly cautious. We're still masking at the hospital. Even, our staff is, I think, 87% vaccinated. So it's still a little better to err on the side of caution especially when possible.
And we did share that that picture, that grid, the yellow to the green to the yellow to the red grid. Yeah. And you're right. It does definitely break down those events and I do think that type of event is even recommended right now to mask because you're in close proximity with unknown. So yeah. Does anyone else have anything that they wanted to discuss? Comments, concerns? No?
Just another shout out from, I agree with Dr. Muhammad's point about the fact that, we're in a really great position with our vaccinations. And I think it's, based on the agility and flexibility of Maureen and her staff. And that includes you, Heather, because I know you've been spending a lot of time doing those vaccine clinics. And it's no small feat to manage all of those moving pieces with the small department that you have and, all the unknowns that you have been dealing with. So I just wanted to give you a little shout out. I think you've done a great job getting those
Well,
folks in other areas vaccinated.
Thank you, Kevin. It means a lot. I appreciate that. And Heather, yes, Heather's been there with us.
I
the
love
whole way.
working. I love working with everyone there and just being out in the community. It's feels good.
Today was fun, and
Yeah.
we've had a good time as well. I mean, if you can have a good time during a pandemic, we do make the most of our time together. And
it's funny, that's the overarching comments. I know I keep referring to my job, but it's what I spend most of my time doing. But we have, including myself, like the big comment from everybody that has been pulled in to do this stuff is that it's so unbelievably rewarding.
Yep.
Whether I was manning the phones or working the vaccine clinics or doing stuff behind the scenes, like the patients are so grateful when we're actually able to get the shot in their arm. I'm glad to hear that you are getting that response from people as well, because I feel like there's no paycheck can compensate you for what you do. I feel like those are the things that really compensate you for knowing that you did a job well done.
And I have to say, I mean, today was my first time doing homebound because I wasn't able to do the first round. And I went out today and I was kind of like, hesitant. Not that I haven't done home care nursing, but it was just a different level. And I was like, wow, this feels even better. Like, I'm going into somebody who can't come out, and I'm educating them, and it's definitely rewarding. I love it. And it's what I was going to say too, is it's an amazing group of Maureen's staff, the City Hall staff that's been doing it, but also very committed volunteers that just are there. Like, no questions asked, the emails come, yep, I'll be there. Yep. So it's been great. It's been great. They've really done a lot with a very, very, you're absolutely right, small department. It's great.
It's certainly been a good team effort.
All right, well, it's 7:29. So do we want to have a motion to adjourn, or?
A motion.
I won't second because I'm not Jean.
Right, I'll second.
And we'll be back. I didn't have the date in front of me, but we'll be back on the second Tuesday of June. I can't believe we're in June.
No, I can't either.
See you all then. Thank you, guys.
Everybody. Thank you very much.
Thanks. Great job, Heather.
Everybody.
Be well. Bye-bye.
Bye.
Bye.
Bye-bye.